Hey guys, Instructor Brooks here, and today I want to talk about skin inspection, specifically the Blanch test. So on my Instagram quizzes, people were getting a lot of people were getting those questions wrong. So I'm going to do a real quick overview of the Blanch test specifically, so that you know what it is, why we would use it, and really what the results mean and our response to those results. So let's dive in here. So first, the Blanch test. The purpose of the Blanch test is to check for circulatory issues or for skin damage. And the circulatory issues could be a whole host of things, from arterial to venous insufficiencies. We're not really going to get into a ton of that right now, but that's really kind of what you're looking for. So how do you perform this test? You press lightly on the area of skin that you want to test for 5 seconds. This is going to push the blood away. And then when you bring your fingers off, the blood should return in about 3 to 4 seconds. If that doesn't happen, then I'm going to show you what you need to do. So the key is to examine the skin for red or other discoloring, like paleness, red, purple, green, yellow. It doesn't matter. Whatever doesn't look normal, then you should be checking it. But what does the data mean? And this is what I've noticed in my classroom, is that the students perform the Blanch test oftentimes in random spots in the body. This is why I have this here, making sure that we understand we need to check the red areas. And this means actually pushing on the area that's sore sometimes. But we need to check that circulation and see if there's skin damage. So let's get down into a little flow chart here on what to do and how to respond to each situation. So first, you're going to perform the Blanch test. Now there's two options. Either the area is going to blanch or it isn't. So let's say the area blanches. Now, if the area blanches and the color returns within 3 to 4 seconds, that's good. But still, if there was redness or discoloration there, we need to investigate why that's happening. Is the device not fit appropriately or whatever? So now, if the area blanches, but the color does not return in the appropriate time, then we should immediately check a distal pulse to check for that pulse depth. A decrease in pulse depth could mean some type of arterial insufficiency. But regardless of the results, we need to contact the PT and then continue an investigation as to why this is happening. Now, what about if the area doesn't blanch? So if the area doesn't blanch and there's redness there, then leave the brace off or whatever. Like, say they've been laying in a bed or a chair for a while, it would make sense that it would be red. So if it doesn't blanch at first, wait about 15 minutes, and then you're going to perform the Blanch test again. Then on the second attempt, if it doesn't blanch, after 15 minutes, then the session converts to a wound care because the skin is damaged. And a lot of people say that they would check the distal pulse, and that's fine. But the concern that I have is if you check the distal pulse and the pulse is normal, are you going to stop and say everything's fine? Well, the circulation's fine, but the actual integumentary system, the skin itself, is damaged. So we need to turn this into a wound care session, consult the PT, and continue an investigation. So that's what you got to think about when doing the Blanch test. There's a lot that actually goes along with such a simple test. So think about this flow chart and start applying it to your actual patients or stuff on a practical, and understand that this is a simple test that can show us so much and is very important to do for all aspects of patient safety and skin integrity. So hope you learned something. Make sure you subscribe to this channel, and otherwise have an awesome day.